Welcome to the Massage Matters podcast from the Massage Collective. Me, Anna Maria Mazzieri, Matt Scarsbrook, and Becky DeMotte Horton. Today we have our very first guest, but before we go into it, make sure that you hit the subscribe button so that you can keep up with all our previous and future episodes. Today, I'm so pleased to have here as our first guest, Dr. Sasha Chaitow. Yes, Chaitow, many of you will be familiar with the name, as Sasha is the daughter of Leon Chaitow, renowned osteopath and one of the great thinkers of manual therapy. Coincidentally, this episode falls on the vigil of Leon Chaitow's birthday. And the topic of it fits beautifully with his ethos and his aims to transcend the boundaries between disciplines in order to provide a true person-centered care. Leon's integration of approaches was underpinned by the awareness that solid, robust evidence was needed. And he encouraged through his Journal of Bodywork and Movement Therapy and his personal professional mentorship, he encouraged clinicians to be involved in the research process. We are honored that Sasha has joined us today, as in our last podcast, we discussed MET, and some of her work is to ensure continuity of a father literacy legacy. This is in addition to the enormous contribution Sasha has made to education as an academic, as a cultural historian, and in the integration of clinical practice into research. So sit back and enjoy the next hour. And thanks, Sasha, for coming.
And thank you very much for inviting me.
So, Sasha, I wonder if you could just start by telling us how Leon, your father, influenced you in terms of his background and his ethos towards his work.
Well, I'd say in almost in every possible way in my approach to learning, in my view of the world, he was obviously, as anyone who's looked at his work will know, well known for his synthesis and his broad outlook and the way that he would connect what seemed like very diverse topics and then go deeper in them. And this, I think, was probably one of his greatest contributions to the world of bodywork. And that's something I think is partly inherited. I think it's genetic, as well as in our respective approaches to the subjects we were interested in, because that's something that I've kind of picked up and developed a very interdisciplinary perspective of my own.
So then, I suppose, without sounding incredibly rude, but so what do you do now? And you know, what sort of I suppose our listeners are perhaps wondering, why have we dragged Sasha in to come and have a chat this week?
Well, thank you. No, thank you for that question, Matt, because I know it's something that a lot of people have been curious about. So even though it's kind of it's always seemed as if I went off in a completely different direction from my father. I didn't study osteopathy. I'm not a clinician. I never wanted to be a practitioner. Actually, this was something that broke his heart when I was in my teens and suddenly said, "Sorry, I'm not going to follow you." But in a very strange kind of way, I went off in a completely different direction, and we ended up kind of colliding in the middle anyway. And he picked up on this because he's always terribly interested in what I was studying. For viewers who don't know, essentially I became a cultural historian, which is not the same thing as a regular historian, because what we do is we kind of trace the paths ideas take through time and look at the way they change and look at the way the world has thought about different things, such as healthcare, in fact, or such as the evolution of scientific understanding or the evolution of a particular religious practice, which has actually been partially my focus. And so my dad and I used to enjoy long, long conversations about similarities and differences between our fields, and realized that actually what I was looking at was the roots and the background to a lot of the things that he had specialized in. So I was digging around in the roots, and he was the one putting things into practice. And a lot of the debates in our respective fields were incredibly similar, oddly enough. So when he became very unwell, very unexpectedly, um, it fell to me, because I was basically the only person there and also the only person familiar enough with his way of working, to conduct a relatively smooth transition for the work he was doing up until when he became ill. And part of that involved a smooth transition for the journal he was editor-in-chief of at the time, Journal of Bodywork and Movement Therapies. And now I'm also going to be overseeing the revision of his books, those many of which are still in print and incredibly popular. So I'll actually be overseeing each of those as they come up for revision, and making sure that they remain faithful to his vision for a kind of interdisciplinary approach to techniques, and depending on the subject, obviously. So that's one big aspect of what I do, and why I'm kind of handling a large part of my father's material. I'm also developing courses and teaching some aspects that are related, very closely related to research, handling research, developing research literacy, especially among clinicians, because I feel that's an incredibly important area. And also, I'm very interested in sort of developing the conversation around education in these areas, and the whole question of translational research. So those are various aspects of
There
what
is there is a lovely, lovely quote from one of your articles, which really I really enjoyed. You say, "I firmly believe there is poetry in scientific research." Yes, can you explore that?
There is indeed. Yes, because first of all, research is all about exploration and understanding. I think one of the biggest misconceptions that can creep in, even among scientists, even among clinicians, is that science is something that is sort of fixed in stone, that is hard and fast. And that couldn't be further from the truth, because every research study, every new trial, every new RCT is just this one tiny exploration moving forward, and every opportunity to design one, or participate in one, or contribute to the literature, but even through a case study, which or a case report, which a lot of people knock, but they come straight from the front line of practice. I think it's so incredibly exciting, because it pushes forward the boundaries of what we know and we don't know. And that constant conversation, that constant exploration, I think it can be absolutely fascinating, because the more you understand it, the more it opens your mind to the possibilities that are out there.
And can I ask, Sasha, when you started sort of taking on your dad's work and looking at all this, what was your impression of um, how research was viewed and the ability to use research within the bodywork world?
Wow. Well, the
Just in a couple of sentences.
just a couple of sentences. Well, it's first of all, the bodywork world isn't homogeneous, and I think it's kind of the catchphrase "evidence-based" has a hollow ring to it, depending on how it's used, because you have folk who will swear by evidence-based practice, but just because something's been published doesn't actually make it evidence, or just because something lacks evidence doesn't mean that it has negative evidence against it. And one of the things I've noticed is that this is kind of forgotten. This gets left by the wayside. And I've also seen, and I mean, I hate to generalize. I really don't want this to be taken as generalization. But I do also see some folk who are excellent practitioners. They're probably incredible at what they do, the hands-on aspect of what they do. They may kind of almost dismiss the need for developing evidence or even participating in that at all, simply because they're not aware of of the possibilities. They're not aware that they could actually contribute to the validation and the the improvement, I suppose, of the public image almost, or within the scientific
It's the
establishment.
fear. It's
Yeah,
the fear.
well, it's fear, sometimes it's ideology, and I mean, the
Mm.
thing is, one of the reasons I think many people don't grasp, one of the reasons that there's this lack of solid research for so many aspects of technique and approach and so on in the bodywork world is simply because the research design may be lacking, or may be lacking imagination, or there may be a lack of awareness or understanding on how just shifting that design and looking more closely at methodology and understanding these things better can lead to asking better questions, and whatever the results are going to be, um, pushing that boundary a little bit further. And one of the things I'm really keen to do actually is to try and develop that conversation and see whether those misconceptions can be improved on. And what I'd love to see is more clinicians actively participating in and contributing, even from their busy practices, because it's so easy to do. It just needs you just need to build in a few extra steps. So when you're taking a history and then following your patients through their process.
So, an observation, and again, I'm going to be accused of generalizing here, but an observation that I've made is that, particularly in bodywork, people generally come to bodywork later in life. Second career is more common than sort of straight out of school or college, and that bodywork is predominantly taught vocationally as opposed to academically. And one of the big differentiators appears to be the lack of critical thinking skills that are taught at a, shall we say, vocational level, where they're perhaps more expected at an academic sort of degree level. And I know that critical thinking is one of the areas that you're particularly passionate about. So I'm going to want to dive into that in some detail at some point. But I was just wondering, I suppose, from your perspective and from the teaching that you do with physios over in Greece, and just your experience of the bodywork world in general, do you think that not teaching critical thinking at the sort of vocational level that people are learning at is doing them a disservice?
I would say absolutely yes, it is doing them a disservice, but on the other hand, I understand why it doesn't happen, because it doesn't happen, it barely happens anywhere, even in advanced academia. Critical thinking is not something that is taken for granted, or that is built in to the majority of academic training. And it's something that you're either going to pick up somewhere along the way. And I absolutely hate to say it, but I have come across hugely educated people, and across the fields, the area of study really doesn't matter, whose critical thinking is decidedly lacking. Um, and it's something that I've been very interested in, as I've worked as a teacher trainer, teaching not only critical thinking skills, but teaching other tutors how to utilize this in their own classrooms. Um, mainly at secondary level, but also at tertiary level, because the principles are the same. The approach is slightly softer when you're dealing with the younger people, and they're also younger people are much more malleable, and it's far easier to develop something that is still, malleable, than to try to help people understand why they may need to unlearn certain thinking habits and then relearn them. Because the older someone is, of course, it'll challenge aspects of their identity, perhaps even, or dearly held beliefs that are harder to work with. But what it boils down to is challenging assumptions and challenging that it's the Dunning-Kruger effect that's been floating all over social media for the past few months.
Yeah.
Getting people to understand that it's okay to admit that you don't know, and to develop that sort of almost childlike sense of curiosity again, and allow that to be a guide. So I think I think we'd be hard pressed to find educational programs, even advanced ones, where this is built into the curriculum. And I'm sure there are some. I'm sure they're out there. But I would dearly love to see more of it, because I think it would be such an advantage, and it would push so many professions forward if it were there.
Mm. So how would you see it being included in something like bodywork, where, as you say, probably the biggest hurdle to overcome is the association people make between what they do and their personal identity?
Well, yeah, good question. Excellent question. There's a couple of things. I mean, especially when when you're being trained in something that's so practical and that's so hands-on, and that's in the end, I mean, I suppose speaking perhaps more of physiotherapy, but I know this also happens in osteopathic schools, for example. I know the training kind of compartmentalizes, almost by definition, parts of the teaching, simply because that's how you organize a curriculum. However, the problem is that students can often get to their second or their third year, and they never realize how this actually hooks to the whole of what they're going to end up doing. And by the time they get there, they're tired. They've been told to study all sorts of things that they may never use, or they may never realize why they need to know. And building in things such as very, very simple techniques, such as starting with with a case, starting with a scenario, flipping the classroom on its head, and giving it to students who may not yet have the background knowledge, but forcing them to think through the questions and ask the questions for themselves, would completely flip it, but would also, and this is really what I'm saying is directed more at faculty and folks who do tutoring. Rather than just leading people through something, um, and then they will simply repeat it and emulate it and attempt to blindly follow. You get them understanding why they're doing what they're doing, but it becomes an active process of learning, and they learn to ask their own questions, and that really is so empowering for the learner. And
Learner-centered education, which that's
absolutely,
why we're saying offline,
yeah,
it really correlates to client center. While
yeah,
before, we used to be therapists, the therapist had the answer, the therapist was educating. Well, now we try the client through motivational interviewing skills to explore what is already within them, and
exactly.
just trying to find the ways so that builds self-efficacy. And the same, I'm a big fan of flipped classrooms. Let the students arrive to that conclusion, explore what's already within the knowledge base, and you're there as a facilitator.
Exactly,
Mm.
exactly. I mean, because as a facilitator, as a tutor, you know where they need to get to, and you know why. But once you get them sort of starting that process for themselves, it becomes so much easier. You're not trying to herd cats anymore. You're just kind of holding up the the piece of cheese or something, and letting them come towards you, and where you will see the gaps immediately, and that's where a couple of well-directed questions can help them do that for themselves. And the beauty is here, you can also build in research literacy as you do that, all within a client's case scenario. It's yeah.
Can I go back a moment, if you don't, to Matt, what you said is you're absolutely right about the fact that because we are manual therapists, because especially if we've been in practice for a long time and we've seen benefits, we might not explain, but we've seen people getting better. We become our practice, we become our therapy, we become our techniques. And when somebody comes and challenges us, we feel we are challenged. They're not challenging the beliefs. We so much feel that we're challenged. And that's when people start with cognitive dissonance, start pushing themselves away to that. So can we somehow, and I'm asking more as an educator, can we somehow introduce within our vocational courses a way to teach students, even cognitive or fallacies, so that the students realizes that actually I might get this result because of that, and actually I might be thinking this way because of that. And I wonder if there are ways in which, although it's a very complex, critical thinking is very complex, but even for our students to now start differentiating so that they don't become too attached to their beliefs. What do you think, Sasha?
Well, thanks for bringing that up, actually, Anna Maria, because one of the, there are methods that can be very quickly picked up by educators to help, firstly, themselves, because the first thing you've got to do is address your own assumptions and your own kind of blind spots and your own, indeed, sort of
Biases.
logical fallacies, and recognize them for what they are and how much they may be emotionally involved in what they do, even if it's subconscious. And there are steps towards, literally, you lead a class, you facilitate these realizations, and then help folk unpick it and kind of replace it with a more effective, I guess, and more critical perspective. And the beauty of it is that once you've kind of put yourself through that process, it's always with you. And we all lapse into certain habits of thought, but once you develop these higher thinking skills, they're with you for life, and they're incredibly valuable, especially for students, for your students.
I think it probably is worth reiterating a particular word in all of that as well, which is that it is a skill. It is something that requires learning and practicing, and I think probably practicing is almost more important once you get a handle on it.
But it is absolutely a learnable skill, and I blame modern education, to be honest, and perhaps the pressures that are put on syllabus designers, and it all comes down to funding and time and how long you've got people in a room for, and it is just people think it's easier, or a lot of early career, especially tutors, may feel it's easier just to go with what they know and follow a particular method. Then you do have the situation, and unfortunately we do have this in the world of bodywork, where there are certain self-appointed gurus, perhaps, who will kind of say, oh, it's my way or the highway, and they offer patents and they offer certificates, and that's a whole big issue in and of itself. And that actually requires a distinct lack of critical thinking.
Yeah, almost the complete opposite. And I must admit, it's one point that we picked up on in the podcast that we recorded about METs, was that what was fantastic about Leon's book, particularly the fourth edition, was that he covers, and I suspect probably with a little bit of your help in the background, but he covers the different theories behind the sort of mechanism of action when it comes to METs, but also at the same time goes, but actually, there's still
don't know.
we don't know, and not knowing is okay.
Yeah.
We can still get a benefit from practicing them in this way, in a way that the weight of evidence suggests works best, in inverted commas, but yet sort of putting the hands up and saying, yeah, I'm not going to trademark this, I'm not going to protect it and all that, because actually we don't know, and that's fine.
Thank you so much for saying that, Matt. And if you'll allow me to just make the point, that was all him. That was very much him. because that's how he was. It was all about gathering the broadest canvas possible, as long as he could find something to back it up with. But at the same time, he thought the whole idea of branding methods absolutely shameful. And I've been extremely disturbed actually to discover that in the couple of years since his passing, there have been people in the US who have tried to use his name and say that they teach the Leon Chaitow method. I'll be after anybody who does that, because the whole point being that it was anathema to him, because his whole ethos, which Becky asked about early on, was about sharing knowledge far and wide, first of all, synthesizing. He wanted those disciplinary boundaries to be erased forever if possible. And most importantly, accepting, being humble, accepting when we don't know something.
Mm.
So yeah, he was never afraid to say, actually, we don't know. And yes, he never used absolutes. He never spoke in terms of absolutes at all. He'd say, show me the evidence, let's evaluate the evidence. And if you can see gaps in it, okay, we know a little more, but we still don't know for certain. And that was all.
He was always in seek for for the question, isn't it? He
Yes.
was always marveled by new research, new understanding, new ideas, and he wanted the solid. He was very so aware that we needed solid research to be accepted, to be able to be recognized and kind of also credible, to increase our credibility. But at the same time, he wanted more and more clinicians to ask questions, to ask the question that would then lead the scientists to research the question. And he used to be marveled at, even after many years. He was telling me once, I miss his conversation ever so much. He was telling me once when he went to one of the fascia research conferences, and I think he was watching Gimberto,
Mhm.
and they put a camera underneath the skin, and he said I was marveled about the beauty of the fascia underneath the skin, and you could see that it's like a child, like a child. Its passion was amazing.
Oh, that passion kept him going to the right till the end, let me tell you. I mean, anything, even, when he was extremely unwell, I mean, days before he left us, actually, I would read his email to him and I'd kind of say, "Oh, and we've got an article about this and article about that." He's like, "Oh, tell me more, read the abstract." And I mean, this is a man, leaving this world, and his eyes would light up. But yes, absolutely, it was that passion for learning and understanding, but he never swallowed anything. I think this is, again, so fundamental to the idea of critical thinking, and, it has practical application. This isn't pie in the sky theory. But you learn something new, and then you hold it up against what you think you already know, and you know what? If it does actually cancel out something you thought was true, well, that's amazing. And I remember when I was very quite young, and he used me as a guinea pig all the time. So he'd push and pull and twiddle and do this and that to my neck, and so he did positional release treatments on me. He did all sorts of MET techniques on me. And I remember when I was younger, he was all about the high velocity thrust. Um, Adjustments, and those dropped away. And so as I became older, he became far more gentle and far more. And I think he really did experiment on me. I just didn't. I just enjoyed the neck rub. And I asked him once. I said, "Oh, Daddy, can you crack my neck for me?" And he's like, "No, no, no, we don't do that anymore because actually this is more effective." And he sat there and explained the whole technique to me. I enjoyed the cracking, but the point being, he was never afraid to revise his views and his practice, and then the excitement of sharing that and explaining to people why one or another thing seemed more effective, not was more effective, seemed more effective, and always, of course, clarifying there's always more to find and learn as you go. Yeah.
Sasha, can I just come back to that point you were making about feeling, something that Leon did, and obviously you do as well, feeling comfortable in saying that we don't have all the answers and that sometimes we don't know.
Yeah.
And I wonder if sometimes some of the false narratives that are around in massage and in body work are because we're put in that situation where we're in front of a client who wants an explanation, and we feel under pressure, if you like, to give them an explanation. And we also don't want to bamboozle them with, an hour's talk on scientific research and things. So we want to, and sometimes those false narratives are nice, simple, understandable explanations, aren't they? So I wonder how, from a practical point of view, how do you think a clinician can embrace being open to not knowing all the answers and feel comfortable in saying that with their clients?
Well, it does require, practice of that nature, does require a certain degree of self-awareness, and B, the ability to read your client. And I know this doesn't come with the training. I know this doesn't go with the territory. And I think that's also an important conversation to have with educators. It actually links back to something I think Anna Maria asked earlier. Um, and I think perhaps this should be built into the training, because that not all clients or patients are going to be able to handle the same information. There will be those who really are educated themselves and they do want the more complex explanation. You can imagine, I am an absolute nightmare of a patient because I try to be courteous, and I try to sort of respect the practitioners or the doctor's perspective. But there are times when I'll simply say, you're missing something, and it's this. And sometimes I'll just never go back. Sometimes it ends up in a much more enriching conversation and therefore experience. But I'm not sure what the actual answer is, Becky, because I think it's something that it's about self-development, it's about self-awareness, it's about being able to gauge which patients can take what degree of information. This all comes into the biopsychosocial approach, of course, but I don't know to what degree that is actually embedded in the training yet. And it also takes me back to something that I only half answered before, regarding how to deal with the whole uncertainty of practice, which is something that's being addressed, surprisingly enough, in a number of medical schools, and I mean conventional medical schools now, which is the introduction and inclusion of the medical humanities in the standard education. And the reason for this is partly to address exactly what you just asked me, and partly because it has been found, and that they've done this in Korea, they've done this in Japan, they're doing this in some schools in the States experimentally, but the results are incredible. What they're trying to do is help medical students, and I'm talking, ordinary sort of conventional medicine here, to help medical students realize that A, science is not set in stone, and B, that their real clinical practice isn't going to be anything like their neat textbooks and their tightly controlled experimental settings. Because when they're faced with a dying patient, or when they're faced with a patient who simply does not follow what the textbook says, or whose stats don't line up with the stats in a meta-analysis, blah, 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 and who responds wrongly to the medication, it's not just about being able to help that patient in the critical moment. Obviously, I'm talking about critical illness scenarios here, but it's also being able to handle their own distress and finding themselves in that situation when all certainty is stripped away. And obviously, this is an emergency medicine in critical care, but it's also, I think, it's something that in body work, when you're dealing with chronic illness and chronic pain, or you've got a patient, or in rehab, in stroke cases, for example.
I don't think
Uh,
it has to be that extreme, funny enough, Sasha. I think,
Maybe not.
at the level of, say, working with a runner with a knee pain, that you just cannot for the life of you seem to figure out the a decent resolution for them. It can be very, very frustrating, and you can feel a bit like a failure, and you can wonder if they think you're a failure, and you can go down a whole dark avenue there. And I think that probably to a lesser extent, but fits what you're saying there with the doctor.
Fair enough. I mean, you'll all have your own stories, which are probably far more realistic. The reason I'm reaching for critical care stories is, unfortunately, I've seen that up close and personal myself.
Sure.
So these are, these are the ones that I can speak to. But so once you've, now you may think, well, medical humanities, what is that? Well, you see, and this is something that I've been doing very successfully in a teaching setting for a long time. The minute that you introduce an extreme scenario or an uncertainty principle in the context of, say, literature, cinema, myth, that you open up their boundaries. You remind them, what is it to be human? We're not just bodies. We're not just bodies with disease, and disease isn't just the enemy to be conquered. It's not all. It's not a chessboard. It's not all black and white. First of all, that gives you the vocabulary to deal with scenarios like that in a safe place, in the broader context of learning medicine and the healing arts. It does cultivate a little bit of humility as well, because obviously one gets introduced to scenarios where one has to confront one's own reactions to them. But again, it's in a safe environment, and that kind of training in the context of learning to be a doctor or a clinician of any ilk, in fact, is a really powerful skill set that can then help you find the words in the context of not being able to help your patient, whatever their complaint. But it also builds a sort of mental resilience in the case of extreme scenarios like I described. Because I mean, I've seen physio walk out on a patient who became absolutely dependent for their rehabilitation, and once that happened, the patient just failed. They just could no longer open themselves to being to working with someone else. And when you are talking about extreme scenarios or even less extreme scenarios, you know better than I how the mental state of the patient will affect their improvement or lack thereof.
Very much so. I'm just having to process all of that.
Yes,
No,
me too.
that was beautiful. I love the humanities in medicine.
Yeah.
That was
Sasha,
beautiful.
no one ever shuts
Yeah.
us three up.
Yeah,
We're
I
all
know.
sat here in
Honestly, it was
silence.
Wow, I don't know if that's a good or bad thing, but
no, very good.
Okay, so I suppose to build on that, or maybe to take a completely different direction. I've no idea anymore. I'm not sure which way's up anymore. But one of the bits I wanted to touch on is translational research with you, or this concept of translational research. And I think that fits in relatively nicely with where we are now, because we're sort of talking about the fact that real life in the clinic is not the same as the textbooks might say, and of course at some point we would assume those textbooks have been written based on research that's occurred in much more controlled scenarios. So I think it kind of fits in here. But obviously translational research is something that you're quite passionate about, or at least the narrowing the gap between what happens in a lab and what happens in the clinic, and making sure that the two actually talk.
Yeah.
Would you mind just sort of talking a little bit around that and the work that you've done there?
Okay, yes. So, I mean, especially when it comes to the bodywork professions, as again, you know better than I that there is a lack of evidence, or there is weak evidence for a lot of things.
Mhm.
And you have to rely a lot of time on clinical judgment, on experience, on other factors. But the evidence, if it works, so we use it. But the evidence base itself is actually quite flimsy still. And that doesn't mean that these approaches are rubbish, for want of a better term. It simply means that the research in this area is still very, very young. Now, in the context of handling research, both in the period when I was managing the journal, my father's journal, but also in other contexts in my own field as well, and so on and so forth. And now, as I prepare a course on precisely this for an MSc in therapeutic exercise for physios here in Greece. One of the key points that I noticed is people aren't really asking the right questions. And you see that in so many postgraduate research degrees, incredibly talented young potential body workers, stroke scientists, they're simply doing a research project to get their degree and get the heck out of there and get on with life, which means that they're asking simple questions that don't really add anything of particular interest. They get published because they can't really, or they get published in third-rate journals, but they get published and that's all they need, really. Is it furthering our understanding of questions we still have? Like, non-specific lower back pain that nobody knows why. There's one that there's never any kind of answer to. And there's, of course, there's so many more. But my sense is that a better understanding of the state of the field, of the issues in this field, of the challenges of acceptance, validation, all of these things, would allow, and this is what I'm planning to kind of lead my own students towards, would lead to more useful questions that could really create stepping stones towards that evidence base and make it a real one. And not only make it a real one, but make it one that clinicians can use, whether it's to explain things, whether it's just about understanding things better, or whether it's like to be able to wave a technique or a practice, hold it up and say, look, now we've got the evidence. And
actually something that is meaningful for the client. I would not say not even the clinician, something that is meaningful and helpful for the client.
And I'd just like to add, I saw an article just a couple of days ago, and it was in relation to craniosacral work, which is very, very iffy, very, very controversial. It comes out of osteopathy. There are many practitioners. My father himself wrote a book on it, taught it. I actually joined a class of his teaching craniosacral work, but it lacks an evidence base, and for that reason, it's been dismissed as quackery. However, actually, it lacks an evidence base. Doesn't mean it's been sort of negated. And the article I read concerned me deeply because I saw that it was actually supposedly a new device that has been able to identify a kind of pulsation in the brain. And this is now being held up as absolute proof that craniosacral therapy is actually for real. But there's all sorts of questions. Like the minute I read it, I thought, how on earth did this get published? Because there was all sorts of questions about the device they were using. And there was just this throwaway line, oh, it's been validated by such and such, and it's trademarked and all the rest of it. Now, a student or somebody who is less well-versed in this, reading that, is going to think, here we are, evidence. But no, this is exactly the kind of thing that destroys the field. And that doesn't answer your question to me, but it's part of
it. It's something that that bothers me a lot. So I would identify myself predominantly as a scientist who finds that he thoroughly enjoys providing bodywork. But it's always made me. I think I was very fortunate. Not to blow too much smoke up Anna's ass because she is here, but I'm very fortunate that I ended up in a school environment that fostered the sort of the critical thinking that I'd like to think I have some ability to do, and it certainly helped because there were elements of skepticism, I suppose, that I came in with. But one of the bits I find frustrating is there are elements of the research that I do think hold potential as by way of providing explanations for what's going on when we're hands-on, explaining what it is we're seeing. But exactly as you say, Sasha, the wrong questions are being asked at the moment. We need to get better at asking the right questions. And for me, slightly different topic, but that goes into questions being related to a very biomechanical, biomedical model versus a much more psychosocial model.
Very good point. Yes.
But I do also regularly get quite wound up when having conversations with practitioners who are claiming mechanisms of action that are, to me, very far-fetched based on a general scientific understanding, and yet the reaction that comes back is quite often, oh well, the science hasn't caught up yet. And I think this is something that particularly bothers me, because on one hand I'm saying, yes, we haven't asked the right questions, so we haven't got the right answers, and on the flip side I'm going, but you can't use that as an excuse for the complete crap you're selling. And I find myself very stuck in the middle on that one.
I'm probably in the same place as you on that, to be honest, myself. Um, and the frustrating thing, which to actually come back around at your earlier question, but also answer this. You see, you have scientists on the flip side. You have lab scientists producing some incredible stuff. Is it always something useful to the clinician? Well, you know what? Quite frankly, a lot of clinicians are never going to know because they can't actually decipher it.
Yeah.
And one of the reasons I think that you're seeing the claims the science hasn't caught up, in a lot of cases, the science has started to catch up. In the foundations are there, the perhaps methods, the lab methods are there. But if the clinician can't formulate the question in a manner that the scientist can grasp, pay attention to, because they're speaking at a completely different level, or they're making wild claims, like you're saying, oh, dismissive claims, oh, the science hasn't caught up. Then the people who are in a position to actually conduct that research further aren't ever going to take it seriously as a line of questioning either. And that's a particular sort of bugbear I've got, where honestly, I feel almost like these two sides don't know how to talk to each other. They speak different languages. And
In the buck as well, to a certain extent, saying the science hasn't caught up yet is almost saying, well, it's not my fault as a clinician. Where what you're saying, and actually I agree with, is, well, as a clinician, ask the right questions, and then we'll go away and work on those questions for you. But if you're not asking the right questions, then exactly as you say, it's not going to be taken seriously. So I actually I like that as a concept of, as clinicians, we ought to be taking a lot more responsibility for this lack of science or this lack of evidence, by working a lot harder at helping develop those questions.
I mean, the way to do, you see, clinicians may often think, well, what am I supposed to do about it? I run a busy clinic. I see, 10 patients a day. What do you want me to do about it? And what it comes back to is, well, become research literate, understand, because it is a game with rules in the end. And I've written this a couple of times now over some of my articles, and I'll keep saying it. It is a game with rules, and like it or not, even if they're imperfect, they're the ones we've got at the moment. Is the RCT the real gold standard? Actually, no, it isn't. It's not ideal, especially when you're looking at body work. And there's all sorts of reasons. One reason being that you can't do proper blinding. But you know what? There are still ways around that. I've seen articles completely dismissing palpation, for example, simply because the
Reliability.
between practitioners.
Reliability.
Yeah. The reliability simply isn't there. Well, fine, maybe you need to redesign it then. Maybe you need to find a different way of looking at this, or maybe that's not the thing you should be looking at. And one way that clinicians can really, really contribute to this, I think, constructively, again, I'll come back to the case report or the case series, where if they're determined to get the attention of sort of the folk in the lab, lab scientists who can perhaps get the funding, get the support, get the resources to conduct a larger study that would provide some sort of more solid evidence, is if you design it right and if you ask the right question, and then if you actually start observing your patients and using what comes through your clinic as a way to explore these questions, put it together into a proper report. If it's properly done, you will find a way to publish it. Again, this is something else that I kind of deliver to my students. how to get published in the sciences.
It's about them feeling part of it, isn't it? This is about feeling part of that world instead of being two complete separate units. If
Yeah.
even with case studies, they can have the value. They can help. They bring some data in, and they can help actually to ask the right questions if they feel part of the change. The problem is that until now they never felt the part. That's why the fascia research conference,
Yes.
they one of their initial mission statements is to bridge the gap between clinician and scientists.
Yes, and I'm proud to say that my dad had a huge part in that
It was
particular aspect, because I mean, what he did, and this is part, I think, one of the reasons I'm passionate about it, although this was something I've been doing in my own field. Like I've chosen to teach sort of more in an outreach setting than go for formal academia, because I felt, what am I going to do in the ivory tower? Talk to, people who kind of get obsessed with the minutiae like myself, but then never take it further to people who might be interested and could really pick it up and do more with it. And that's what kind of why I've preferred doing sort of more independent teaching. But yes, Anna Maria, you're absolutely spot on. It's about understanding that every clinician could be part of the conversation.
Mhm.
Yeah, maybe they'll need to do a weekend course. Maybe they'll need to brush up their writing skills. Maybe they'll need to partner with someone who. On the one hand, the clinicians kind of doing the observation and taking down the data. They need to learn how to do that. There are set protocols for doing that. Very easy to learn. I mean, it's routine. It's like taking a case history, only added details. Partner with someone who can write better than you if you can't write very well. I mean, it's really as simple as that. Get it together, get it published, get yourself to a conference, present a poster. It's not that hard, actually. It's just about knowing the steps. Why would anyone care? Well, I think if one does care about the profession or sees a number of patients come through with a frustrating problem and realizes there isn't enough work on that, put the question out there. And these are the channels through which to do it. And I think it would be incredible if we saw more from the front lines making it into the literature, because it's a stepping stone.
Absolutely.
Yeah.
It is, and I think it's a very, very important one. I think, not to sound incredibly cliche, but we're definitely at a point in time when it's never been easier to do that, simply because the ability to communicate with, like you say, other people who may have some of those skill sets or have an interest in the skill sets that you're lacking, that you can partner with, or that you can learn those skill sets from in order to apply them yourself. It's never been easier.
Exactly. And I guess on the flip side, um, I think we're going to see a sea change in a lot of the ways that research and scientific publishing and the evidence base is viewed off the back of this pandemic,
Mhm.
precisely because of the whole infodemic
Mm.
Yeah.
that's gone on. Now, part of that sea change, unfortunately, is that there seems to be a determination in sort of medical circles, in scientific research circles, to crack down on anything resembling pseudoscience, but the trouble, or anything that has shaky evidence. But the trouble there is, that kind of the wheat goes out with the chaff, baby bathwater, all of that, and it's actually hugely concerning, because it could potentially mean scrutiny, a kind of scrutiny that could severely damage some areas of practice that do deserve the time to develop, for the science to catch up. But these conversations need to be had. I think you need to get people really talking to each other more and collaborating more on efforts like these. Because I do fear there may be a change in the way these things function.
I wonder, Sasha, you touched on it in an article you wrote recently, and talking about some of the pseudoscience that's come out around COVID, and like you say, that reaction to that. I wonder how much you think social media has to do with that, and the fact that it does tend to polarize people, and you pick your position and then you kind of throw science at each other to try and prove your permission. And also that whole clickbait culture, isn't it, of if I come up with a snappy headline that's based on really shaky science, people read that headline and take it as fact rather than maybe question it. I wonder what's your view on that, and also how do you see us using that way of communicating, but as a better method than we do at the moment?
Yeah, you're absolutely right. I think it's a huge, huge part of the problem, to be honest, because now, everybody everyone's got an opinion as well as lots of other things. But um, yeah, how can we improve on that? Half the problem is that this quote unquote science people are slinging at each other is just not even science, it's junk. And that the whole idea that a YouTube video of someone spouting their kind of opinion that is backed up with dubious argumentation um, is even research at all. Oh, this person's got so many titles, or they claim they do. They're confirming my biases. Hey, I've done my research. You should listen to this. Well, yeah, we were saying a lack of critical thinking is a critical problem. Here you go. There's the proof of it. Um, and I don't think it's going to go away. I don't think this noise is going to go away because it serves a lot of interests, completely different interests from commercial to political to God knows what. How do we counter it? Well, I think the only way to counter it is just to keep leading by example, is to be the calm voice in the noise, never, ever, ever get embroiled in that kind of thing, and never, ever, ever get emotionally involved in it either, because that's usually where discussions like this go south, on social media, I mean. Um, I it's a very difficult battle, but I think the only place to counter it actually is in the classroom in the end.
Yeah.
Um,
Education,
Education.
absolutely.
I mean, we
Yeah.
talked about this, I think, on air, off air, in the pub when that was allowed. That
Yeah.
I think a lot of, particularly, I mean, okay, we can only really speak from bodywork education, but there is an awful lot of pressure applied to therapists who are perhaps not quite so contemporary with their thinking, or with the narrative that they provide around their treatments. And as a singular therapist, it can be terrifying to find out that everything that you've been taught is complete rubbish, or to that effect. But I think we need to be taking a really, really hard look therefore at what we're teaching therapists. We can't expect that. There's definitely this element of when someone in a position of being a teacher teaches you something, you take it verbatim. How often are people confident to actually stick their hand up and go, well, that doesn't seem to make sense to me? And so we've got to be really, really critical, I think, about what is being taught, and that is definitely something that we are, I think, as a collective, very passionate about.
Yeah. But also as tutors, I'm very critical of educators as well, Matt. Tutors should make the classroom a safe environment for being challenged. I mean, as an educator, you know how fantastic it is when students come to you and they says, "Oh, well, actually, have you thought of that?" Oh, wow, actually, I never thought of that myself. It's great because they bring in a completely unbiased view.
Yeah.
And they can only do that though if the room, that's why I love flipped classrooms models,
Yes.
because you create an environment which is safe for them to do that. It fosters individuality.
And critical, not only
Yeah.
the critical ability, but it's incredibly empowering for the learner. Incredibly empowering.
Mhm.
And it sort of equalizes the power relationship between teacher and student, but they also get to realize that, okay, there are skills that I can pick up here. And I mean, it's one of the reasons that in the class I'll be teaching for the physios, I start off with critical appraisal, and I'm literally planning to throw research papers at them and sort of say, okay, guys, you've got half an hour, get into breakout groups and tell me what's wrong with the will I've given you. And it's literally, giving them the chance to get stuck in and look at it and think for themselves. So, yeah, I can sit up there and just point things out. Well, that's no good, is it? Because all I'm really teaching them is to swallow things without actually thinking about them. And again, it's slightly perhaps off topic. It's not off topic, but it's how do we counter the infodemic? I know that sort of conventional medical sources are planning to go on the offensive, and they're planning a huge communication campaign. This is, I think, in the introduction to my article on science and pseudoscience. I actually had a great quote where the potential ways of addressing conspiracy theories and all the social media nonsense are being discussed. And part of it is training up a whole new generation of science communicators to better liaise with the public. But you can imagine what this means for the professions that are excluded from that particular
almost
set of.
by definition, they are therefore pseudoscience.
And even if they're not, even if they're not, by definition, they're going to get bulldozed. They're absolutely, it's going to be a slaughter. And the danger there is that then we come back to this whole dismissal of the science establishment. Oh, it's big pharma. Well, yeah, big pharma is real. Yes, we all accept that. But it doesn't mean that is, that you're actually talking any sense either. You see, it would be my answer in a scenario like that. When we're talking about trying to get clinicians involved in the science, I think it's never been more critical, actually.
I think if anything, we as clinicians need to become science communicators.
Rapidly, urgently.
Yeah.
And in a position, I mean, this is perhaps the greatest part, again, why I feel passionately about this. It's the greatest part of my father's legacy as well, was the fact that he saw osteopathy and naturopathy through from fringe back in the 60s when he was studying, okay, through being called alternative medicine, through being called complementary, so suddenly it was an adjunct, through to integrative, and through into NHS practices and a university department. That's unraveled. In recent years, partly due to lack of funding, lack of interest, perhaps lack of vision since he retired. And this was several years ago. But it would be a crying shame and he didn't do that on his own, but he was in the front line. It would be a crying shame to see that devolve if sort of representatives of the professions don't get it together.
Absolutely. And I think, for us as one of the reasons behind us three sitting down with microphones and inviting people like yourself on, as much as anything else, is to try and help, I suppose, support that movement forward, that idea that we need to become better communicators around what is and isn't happening. We can be confident about that, and working towards this level of acceptance by mainstream healthcare, if you will, of what is still currently termed complementary healthcare, will only come from speaking the right language and playing the game by the right rules. Like you said, it is a game. It has rules. We know very well what they are. That's not a secret. And I truly believe we can play extremely competitively within those rules. We've just got to all start playing.
And I mean, from a very human angle, I can totally understand why there are very disillusioned people out there who are like, you know what, scientific establishment, who cares? I know my methods work. I know my patients get better. And I'm sure they do. And I'm sure some of them are incredibly talented healers. Yes. But what are you doing for the profession that you love and serve then? As much as anything else.
So if we were to, so one of the features of the podcast is what we call theory to practice, which is where we attempt to distill a couple of points out of what we've discussed, for people to sort of go away and apply immediately if best we can. And for me, I really liked it because actually it matched up with one of the editorials from the Journal of Bodywork and Movement Therapies, where you discuss the fact that clinical relevance and takeaway bullet points were becoming mandatory for manuscripts that were being submitted. And I was like, oh yeah, I like that. So not to completely put you on the spot, I'm hoping I've waffled long enough that you've been able to have a bit of a think. But if you were going to send people away with a couple of points on what they might be able to do to improve their position, their critical thinking, the strength of this fantastic industry, what might those be?
Okay, so first of all, I would say take a look. I mean, you can literally Google it, logical fallacies, and have a good think about. You'll find lovely lists of them all over the internet, and have a look and think about how some of them may apply to your own thinking. But try and do this with, you don't need to tell anyone, so you're not going to get embarrassed. Really challenge your own assumptions, and this is kind of, sort of something we have to do on our own, and then try and apply it in your daily practice. Think, okay, so I was making XYZ assumption about said patient. Okay, how can I flip that on its head and think about it differently? And this can be a totally internal process, so no one's going to know. But it may be very revealing about one's own inner biases and perhaps where they come from. Secondly, I would say perhaps take a look at the state of the field and what are current burning issues, current burning debates. And this is a corollary, really. Where do you stand on them and why? Ask yourself why. Do you dismiss the science? Do you think it's irrelevant to you? Why? You're too busy? Do you not think you could contribute? Why not? Okay. Look up how to write a case report. Yeah, you can't just do it off the bat, but you know what? It isn't that hard either. Don't you really have a single patient that you could potentially submit and like to know more about? Get a feel for the literature, get a feel for what's going on in the field. Do this in your downtime. I'm sure everyone's got more downtime under lockdown. Um, and as a corollary, sorry, to that, research literacy. I've written a couple of things regarding that. You can literally do free courses as well, which kind of I know that some of the American massage therapy associations have really nice little um, rundowns of how to approach and evaluate a paper. And there's
Got
a very material out there.
little video on our own YouTube channel, where a very good looking chap talks at the camera for about 10 or 15 minutes explaining how to pull a paper apart. It's definitely worth it.
There you go. I didn't know that. So
No, it's all good. No. Well, there's a reason I haven't published it to everyone. It's useful. We have brilliant feedback on it. So
okay, so even better. Right on this website then. Okay, look and always question the evidence. Always question the evidence. Don't follow. There is no such thing as an authority. My father was quote unquote worshipped as this icon, as this guru, as this authority. Can I tell the world how much he hated that? Can I tell the world? I mean, I know that you, Matt and Becky, didn't get to meet him, but Anna Maria knew him well. And the kind of thing he cherished was the ability to have a good, solid conversation with a colleague who he trusted and who got him. And I can say that Anna Maria was one of those people, very much so. Okay, because he could get quality exchange and out of that. but he knew that he was held up by some as this whatever figure. He hated it because he knew it meant that people weren't using their brain.
Yeah.
And they were just blindly following it. He never, ever wanted that. He loved being challenged. So, you invited me on partly to talk about his legacy. So the last kind of bullet point I'd like to leave you with is, believe in your own ability and explore further and never take someone's word for anything. And I think that's about all I've got for you.
Well, thank you very much.
That was amazing.
Um,
That was amazing.
so-
That was amazing.
Well-
That was contentful. Yeah, that was absolute contentful. I got so much, so much right in here.
So I think that's a perfect place to leave it, Sasha. Thank you so much for joining us. It's just been full of absolute pearls tonight, and hopefully has given people lots of things to think about. If people want to read a little bit more of your work, you've got a fantastic article in the Massage and Bodywork magazine where you've got the somatic research column, which contains a lot of the articles that we've referred to tonight. And also there's leonchaitow.com website, which obviously talks a lot about your father's work, but you've had a huge input in as well. So if people want to find out more, those are the best places to head to do so. But thank you ever so much for joining us. It's been an absolute pleasure.
Thank you for having me. Keep up the good work. Thank you.
Thank you.
What a contentful hour. That was awesome. So that's it for us today. Remember to hit the subscribe button. And if you want to have a chat with us or ask any question, you can find us on Facebook under the Massage Collective, or email us at massage@physio-matters.com. Looking forward to see you for our next episode.